Welcome to our webinar today on managing a pneumothorax with the ASL 5000 lung solution for SimMan. My name is Liz Bolin, and I am the account executive here at Ingmar Medical. I have a pretty colorful sales background in the healthcare industry and have sold medical supplies such as catheters and ostomy bags, all the way to exam preparation software for medical students and residents. I've been with Ingmar Medical for just over a year now. I can honestly say I know so much more than I ever thought I would about the lungs. And being someone who struggles with asthma, I have a whole new appreciation for our lungs and especially the people that care for them. We've tried to make today's presentation as concise as possible to be cognizant of your time. So we will try to limit the duration to about 30 minutes. The first 20 minutes will be the presentation, and we will leave at least 10 minutes at the end for Q&A. We will be muting everyone's audio during the presentation, but please feel free to submit questions at any time throughout the presentation using the chat panel through Zoom. We will answer as many of your questions as possible after the presentation. As always, a recording of the webinar will be made available to you via email. You can also access the recordings for any of our previous webinars under the training section of our website. We will be distributing a survey via email as well, so please let us know how we can provide you with the best possible webinar experiences going forward. For today's webinar, we will be running a scenario using the ASL 5000 lung solution for the SimMan platform. Ingmar Medical and Laerdal have collaborated to combine the world's most realistic breathing simulator, the ASL 5000, with the interdisciplinary benefits of the SimMan. This solution allows you to create and run hands-on, high-fidelity mechanical ventilation training scenarios. The ASL 5000 contains a piston moving inside of a cylinder. The movement of this piston is used to generate realistic breathing patterns, which represent a nearly unlimited number of respiratory conditions. And with the ASL 5000 lung solution, we are able to control the movement of the piston with the Laerdal Leap software. Our scenario today will feature an ICU patient with severe ARDS who is being supported by a ventilator. The learner will find the patient on inappropriate ventilator settings, causing high peak airway pressures and high PEEP. The patient will be tachypnic and desynchronous with the ventilator. As a result of high pressures in the airway, the patient will then develop a right tension pneumothorax. The main learning objective of this scenario is for the learner to identify the tension pneumothorax and treat it in a timely manner. Therefore, the simulation will end directly after the instructor sees that the objective either was or was not met. The scenario will be pre-recorded in an effort to provide the best visuals from the LEAP patient monitor, the real ventilator screen, and the SimMan mannequin in an efficient way. Today's scenario was created using LEAP themes, and one of the main purposes of today's session is to show what a mechanical ventilation scenario looks like when it's created using LEAP themes. So let's learn more about what a theme is. A theme allows us to preset the patient's vital signs displayed for the learner on the Laerdal patient monitor during the simulation. Themes also allow us to prompt the instructor to make the necessary changes to the patient's respiratory parameters using the ASL 5000 plugin windows. Our theme includes 4 states that represent our patient's changing condition, including the 2 different outcomes surrounding our main objective. Each state includes the associated patient information, vital signs, lung sounds, and instructor message. Let's review the components of our theme a bit further and see how they come together to create the scenario. Using LEAP themes, we have prepared 4 states. We have the initial condition of severe ARDS, the occurrence of the right tension pneumothorax, and then the 2 separate outcomes of either the needle decompression or the cardiac arrest, depending on the learner's reaction time and decisions. For example, if the learner meets the objective to identify and treat the tension pneumothorax, we will activate the needle decompression state. But if the learner does not meet the objective and either makes the wrong treatment decision or takes too long, we will activate the cardiac arrest state. You can create as many states, including possible outcomes, as you see fit. However, we have found that most instructors stick to one main objective for their scenarios. That way, you're able to create definitive correct and incorrect answers, and you're able to stay in control of the simulation. This prevents the learner from straying too far in the wrong direction. Some components of each state are automatically made just by activating the state, such as vital signs and lung sounds. However, some components, such as the initial ventilator settings and the respiratory mechanics, will need to be configured manually. Therefore, as we change from one state to the next, we have configured instructor messages to pop up that will give us additional information and further instruction. In this example from our scenario, we are told to use the ASL Quick Choice menu to select our initial respiratory condition and to set our initial ventilator settings. We are also instructed to activate the tension pneumothorax state while the learner is making the initial adjustments to the ventilator. These instructor messages are completely customizable, so you are able to put as much or as little information and instruction into them as you see fit. During our scenario, you will also see some resources the learner will use to assess the patient and make treatment decisions. For this particular scenario, the learner will be expected to assess the patient's condition using the LEAP patient monitor, the information presented on a real ventilator, and the chest rise of the SimMan mannequin. When creating each state, we pre-configured the vital signs we wanted to appear on the LEAP patient monitor. So those vital signs will appear automatically just when we activate the state. The patient ventilator interaction occurs in real time. The SimMan is intubated in this scenario, and the realistic breaths coming from his mouth are generated from the ASL 5000. Lastly, the unilateral chest rise on the mannequin occurs automatically when the pneumothorax is activated. This occurs automatically because the ASL 5000 sends volume data to the SimMan in real time to present the appropriate chest rise for the given scenario. When the theme is complete and ready to run, all of the components come together to create your scenario. Because the windows used to control the ASL parameters are built within the standard LEAP instructor application, they exist alongside all of the windows that are standard to the LEAP environment. This means that we can complement the respiratory disease states simulated by the ASL 5000 with various LEAP windows that provide the learner with additional information used to assess the patient. For example, when we activate the right tension pneumothorax theme state, the airway and breathing window shows the right tension pneumothorax as active. The mannequin's chest rise will appropriately change to unilateral based on information from the ASL 5000. The patient monitor will reflect the appropriate vital signs for the learner. And the ASL monitor will show the appropriate pressures, flows, and volumes for a patient with a right tension pneumothorax. So we, as the instructor, are viewing something like this, with the LEAP windows and the ASL windows coming together to provide us with the information we need to advance through our scenario. And that includes theme states, the patient monitor, real-time flows, pressures, and volumes of the patient, and the current respiratory disease state, severity, and mechanics. And it's good to know you can even customize and save your own layout. And the learner is referencing the ventilator interaction, the vital signs, and the patient just as they would in real life. So in the end, all of these components working together gives you a high-fidelity mannequin simulator, which can be intubated and placed on a real ventilator for realistic, hands-on training scenarios. Our goal with the ASL 5000 lung solution is to make the learner feel like they're in a real ICU, faced with the anxiety of treating a critically ill patient on a ventilator. Now, let's take a look at today's scenario. Today, I will be demonstrating a live scenario using the ASL 5000 lung solution. Before we begin, I'd like to give you some background information on our patient. Our patient is a 28-year-old male who is 182 centimeters tall. He has severe ARDS. To run this scenario, we have created a theme within the Laerdal Leap software. A theme allows us to preset the patient's vital signs displayed for the learner on the Laerdal patient monitor during the simulation. You will notice the respiratory rate is currently blank. The respiratory rate will be determined in live time from the pressure sensor in the ASL 5000 and populated on the patient monitor during our simulation. Themes also allow us to prompt the instructor to make the necessary changes to the patient's respiratory parameters using the ASL 5000 plugin windows. As we begin, a pop-up provides the instructor with the information necessary to set the stage for the scenario. Here, we are instructed to set our initial ventilator settings. We will set the ventilator to pressure control with an inspiratory pressure of 40, an inspiratory time of 0.75, a respiratory rate of 30, and a PEEP of 20. Note that we are also instructed to activate a right tension pneumothorax while the learner is in the middle of making their initial adjustments to the ventilator settings. We are also instructed to go to the Quick Choice menu and select our severe ARDS patient. At this time, we will introduce the learner to the scenario. The learner recognizes that the patient is tachycardic, hypoxic, tachypnic, hypertensive, and hypercapnic. Because the patient is in such distress, the learner chooses to make some initial changes on the ventilator, such as dropping the inspiratory pressure and dropping the respiratory rate. While the learner is making these initial adjustments on the ventilator, we will activate the right tension pneumothorax. The instructor is informed that the pneumothorax feature is linked to our ASL parameters, so the necessary respiratory changes will automatically occur with one simple click. At this point, as the instructor, we're in control to determine when to activate the next appropriate theme state based on the learner's reaction time and decisions. The learner observes that despite their initial adjustments to improve the patient's condition, the patient's vital signs are deteriorating significantly. The heart rate has increased to 180. The oxygen saturation has decreased to 70%. The blood pressure has increased and the exhaled carbon dioxide has decreased. In addition to the vital signs, the learner should also observe deteriorating conditions on the ventilator. The tidal volume has decreased to about 200 milliliters, and the patient is still desynchronous with a high respiratory rate. At this point in the scenario, we will demonstrate two separate outcomes as a result of the learner's decisions. In this first outcome, the learner does not identify the tension pneumothorax. The learner decides to take the patient off of the ventilator since the patient is in such distress and begins to bag the patient and call for help. As a result of the learner's decisions, we will advance into the next appropriate theme state in which the patient enters cardiac arrest. By activating the cardiac arrest state, the patient automatically becomes apneic. This occurs automatically because we set the heart rhythm to PEA, which triggers the respiratory rate to trend to 0. The cardiac arrest is evident on the patient monitor, and the learner begins resuscitation. Resuscitation will continue for 3 minutes, and the simulation will automatically end. In this outcome, the learner did not meet the objective of this scenario to identify and treat a tension pneumothorax. At this point, the instructor and the learner can debrief. In our second outcome, the learner does identify the tension pneumothorax. After observing the deteriorating vital signs and the patient-ventilator interaction, the learner observes unilateral chest rise on the patient. The ASL 5000 sends volume data to the SimMan in real time to present the appropriate chest rise for the given scenario. The learner decides to perform a needle decompression. After the procedure is performed correctly, we will advance to the next appropriate theme state. The vital signs will stabilize over 3 minutes. At this time, the learner is expected to reassess the patient and the ventilator settings, and the instructor and learner can debrief. That concludes our scenario. I hope you enjoyed what we put together. As a quick overview here, themes allow us to create structured scenarios. We can pre-configure settings such as vital signs and lung sounds so that they occur automatically as we move from state to state. And we can trigger pop-up messages that prompt us to make changes to the respiratory mechanics or give us additional information. Instructors are in control using both the LEAP windows and the ASL windows to move from state to state depending on the learner's treatment decisions and reaction time. And the learners will use resources such as vital signs, the real patient-ventilator interaction, and the SimMan mannequin to make their decisions just as they would in real life. Now we are going to address any questions you may have. Please type your questions into the chat panel under Zoom and we will address them live. To help with your questions, I have Product Manager Brian Lynn and Clinical Educator Kimber Catula with me. Welcome, guys.
Hello.
Hi. Hi, everyone. Thank you, Liz, and thank you to everyone joining us here today. My name is Brian, and I will be helping out with the Q&A portion here. So feel free to submit those questions in the chat panel in your Zoom menu. Okay, one of the initial questions we have here from Marcia is regarding the cost of the system. And for that, we will refer you to your Laerdal representative. Laerdal is the organization responsible for quoting and selling the lung solution. Ingmar Medical is certainly here to support customers both pre-sale and post-sale. But Marcia, you will receive a survey at the end here where you will have the chance to indicate that you're interested in receiving that type of information. And Ingmar would be happy to connect you with your Laerdal representative for that purpose. Okay, we have another question from Mary. Mary asks, is the system compatible with Sim Junior or Sim Newbie? So currently the system is compatible with 4 different Laerdal mannequins, and those would be the SimMan 3G, SimMan Essential, SimMan Essential Bleeding, and the 3G Trauma. So essentially we are currently limited to the Essential and 3G versions of the SimMan mannequin. We hope to continue expanding compatibility to other mannequins within the SimMan platform, and specifically those that are controlled by the LEAP instructor application. But to answer your question, currently we are only compatible with those 4 adult mannequins. To elaborate a little further though, Mary, the ASL 5000 itself, as you may know, is capable of simulating breath patterns from neonatal to adult. And in fact, there is a way currently to use LEAP to control the ASL parameters while it is connected directly to the ventilator. So in that case, you're bypassing the mannequin portion of the environment, but you are able to simulate breath patterns which include lung mechanics that are consistent with neonatal and pediatric patients. It's just that currently that type of simulation would need to happen with the ASL 5000 connected directly to the ventilator. And we'd be happy to explain that a little further to you as well if you have more questions. Okay, so here we have a good question here from David. David asks, can you discuss the role of the learner in this simulation? Do you see it running with a single student or a small group? That's a very good question. And in fact, I believe the answer is that it could theoretically be used for either type of approach. In fact, for our customers and in our experience, we've seen it run both ways. So typically, I see small groups of students, maybe up to 10 maximum. Sorry, maybe I got a strange look from our clinical educator here.
Depending on how you're running the simulation, so if you are doing it to be a realistic type of simulation, you could do it with 1 student, or I would say a small group no larger than 5. But you can also pull this into the classroom and do a large demonstration and just have a discussion about it too. So you really can use these scenarios however you would like, whatever is most appropriate for you.
Yeah, exactly. I would agree with that. So we've seen customers who use the system to demonstrate simple concepts, one concept at a time in front of a larger group, but typically the scenarios are limited to small groups of students who are expected to get their hands on the real ventilator and do some hands-on training. Okay, so we have a question here from Carlos. Carlos asks, can the simulator trigger the ventilator for weaning trainings? And the answer for that is an emphatic yes. That's actually one of our main advantages, or one of the main benefits of using our system, because the ASL 5000 is capable of producing a real negative pressure that's sensed by the ventilator as a spontaneous effort. So that's really as I said, one of the main advantages that we're bringing here to the SimMan system, this real negative pressure. In fact, Liz alluded to this during the presentation, but with our system, as you're simulating a spontaneously breathing patient, you can put your hand physically over the mouth of the SimMan and feel the airflow coming in and out. And when a ventilator is connected to the SimMan, the ventilator will sense those breaths realistically as well. So we have many customers who are using the system to conduct scenarios on spontaneous breathing trials currently.
To add a little to that, Carlos, you also have the ability to control the patient's effort, like Brian said, but the degree of it as well. So if you want them to actually fail the breathing trial but still make efforts or weak effort, that is possible as well too, to give that experience to your students.
All right, so a question here from Rusty. Can you make the Ingmar settings automatically in the LEAP theme editor, or do you need to alter the ASL settings manually? So we definitely want to be careful here with setting expectations, because there are some situations where our ASL parameters can be preset and triggered automatically, but the majority of the time, they will need to be manipulated manually. So that means when you're building a theme state, you will primarily use instructor messages as a way to prompt you to make the necessary changes to our ASL windows. You can make that a lot easier on yourself, though, with the feature that we've built in to allow you to save custom lung models. So that's, in fact, what we would really encourage you to do. So to prepare for the simulation, you would be able to configure combinations of respiratory parameters that provoke the intended interaction on the ventilator, and then you can simply save those as custom models that could be called upon during the scenario. So you could essentially move from one custom model to the next, as is appropriate in conjunction with the current theme state. Now, as you saw with today's scenario, there are some exceptions to that, such as the pneumothorax feature. So that airway and breathing window that's standard to the LEAP environment allows you to set conditions like the pneumothorax. And we have built an automatic link between those features on the airway and breathing window and our lung parameters. So that means in those cases, if you're, just as you saw today, if you're activating a pneumothorax with a theme state, then you won't have to make any changes to our lung parameters. Those would adjust automatically. But in the majority of cases, you would use an instructor message to prompt you to move to your next prepared custom lung model.
Carlos also asks, can we simulate paradoxical chest rise? I'm not 100% sure, Carlos. I don't believe that's possible with the mannequin, but we're not experts on the SimMan 3G. We're experts on the ASL and how it integrates into it, but I don't believe so. But please check with Laerdal.
Yeah, that's something you can discuss with your Laerdal representative. If it's possible from the Laerdal end, then it's safe to say that we can prompt that with our ASL. So that's sort of the thing to keep in mind there, is that we're at any moment during the simulation sending volume data back to the SimMan system from our ASL 5000's pressure sensor to tell the SimMan which chest rise to supply. So Marcia asks, is the needle decompression required to be performed or selected as an option? And the answer to that actually is it could be done either way. So, the SimMan 3G has a built-in sensor that would detect when a needle decompression has been performed. And so if you do want your students to practice physically performing the needle decompression, that is automatically linked to the SimMan pneumothorax feature. So performing that needle decompression physically will deactivate that pneumothorax feature and consequently resolve the lung parameters. But as you saw in today's scenario, you can alternatively use a theme state to trigger that resolution of the lung mechanics and vital signs. That's what we did today. And so really it could be done either way. The creation of the theme state would allow you to simply have your students verbalize, for instance, that they would like to do a needle decompression. So in short, yes, it could be done either way. We have another question here from David. David asks, will you be exhibiting at AARC? So yes, we will be at booth number 313, and we will absolutely be demonstrating the ASL 5000 lung solution. We'll have a SimMan, a ventilator, an ASL 5000, and everything necessary to give you a hands-on demonstration of the system. So please feel free to visit us at AARC.
A different David asked, if the student decides to disconnect and bag the patient before the arrest occurs, will there be a problem with ventilating via the bag and it breathing with the ASL 5000? And the answer is no. So the ASL, you can just put the ambu bag right onto the ET tube on the intubated patient, and the ASL can handle bagging absolutely fine as well. Or putting it back on and off the vent, anything like that is possible.
Ahmed asks, is it possible to use the ASL 5000 Ingmar software and the ventilator? So I'm not entirely clear on what you're asking, but I think it's in relation to our own RespiSim software. And the answer is that we do have another software program called the RespiSim software that we use to control the ASL 5000 for the purpose of educational scenarios. So that software program does exist. In addition to what you've seen today through the LEAP software. But those two are essentially mutually exclusive, meaning that you can't use them in conjunction with each other in any way. You will have to make a decision on whether you're using the ASL 5000 in the Laerdal LEAP environment or the RespiSim environment. They both give you access to the same ranges of respiratory parameters, so in either case, you'll be tapping into the full potential of the ASL 5000. Okay, so I believe we are running out of time here. We have a couple comments just thanking us for putting on this webinar, and I'd just like to say our pleasure. We are very happy to continue doing this, and we do plan to continue having webinars frequently. Thanks again, everyone. As I said, please fill out the survey so we know what we can do better the next time around, and we'd love to continue having these for you. And thanks again, and have a wonderful day.